Thank you, Mr. Chairman. We have an amendment that makes the bill.
The chair will move the bill. Vice
Thank
Chair Lundberg seconds the bill. There is an amendment which is 006244. Is that the amendment you want to go on, or do you want the 006388 to be the amendment to go on?
Well, the one I have in front of me is 6388, and
Okay.
I believe that's the one we need to.
Okay, can you withdraw?
I'd be delighted to withdraw drafting code 6244. Your assistant is excellent at the little coaching there that I received. Thank you.
All right. Okay, so this amendment was never adopted on this bill, so the member can withdraw the amendment. So that's what your request is that
Thank
we
you.
withdraw
Thank you.
6244. Now the chair is moving amendment number 006388. Vice Chair Lundberg is second on the motion for amendment 6388. Chairman Roberts, you're recognized.
Thank you. Mr. Chairman and committee, let me start with this quote. Now, by what sense do we have in a regulation in government that says we'll pay $6,000 a month to keep someone in a hospital that we believe would be better off at home, but the family cannot afford 1/6 that amount to keep them at home? That quote is from President Ronald Reagan. And he recognized that one of the problems that we have with our government institutions is that we put means test, income test on who would receive benefits. And if you're institutionalized, if you're a child that's institutionalized, the government will pay for it. But if you have a family that's ready and willing to keep that child at home, to give that child the love and the care that it needs, suddenly you may not qualify for the assistance you need to be able to do that. So as a result, families are often forced to institutionalize their children rather than caring for them at home. This gave rise to a program known the Katie Beckett Program, named after a little girl during the Reagan administration, that created the opportunity for people to apply, for states to apply for a waiver to their Medicaid program to allow them to use federal dollars, state dollars, to pay for children to be able to be at home and be cared for at home. So the states have different programs. They're not all alike. They all go under the general name of a Katie Beckett waiver, but the programs differ from state to state. So what you have in front of you is an amendment that would require TennCare to go to CMS and get the waiver necessary to bring a Katie Beckett program to Tennessee. That brief explanation, I know, Mr. Chairman, there are some people who want to give some testimony today, and I'd ask that we go into recess and hear from them.
Members, without objection, we'll go into recess, and I'm showing that we have Mr. and Mrs. Kaufman, and we also have Tori Goddard. Okay. Yeah, absolutely. That's you. And so if you don't mind, I believe there's plenty of chairs. All of you can certainly come to the table. And again, as you bring your testimony, if you would identify yourselves, make sure the little red light is on. I know.
Good afternoon. My name is Adam Kaufman.
Good afternoon. My name is Dr. Rondi Kaufman. This is our daughter, Adelaide.
Adelaide?
Yes, sir, Adelaide. First, we want to thank the members of the committee and the Tennessee Disability Coalition and Senator Roberts for this opportunity to share our story. Adelaide was diagnosed at 4 weeks of age with a condition known as spinal muscular atrophy, or SMA type 1. This is a terminal diagnosis. Though this condition does not affect a child's mental, social, or emotional development in any way, 90% of children with SMA type 1 do not live to the age of 2, as they lose the ability to move, swallow, and breathe due to the progressive loss of motor neurons. There's a new treatment that slows progression, and Adelaide's responding well to that treatment, but even so, she requires around-the-clock care. She is tube feeding dependent. She is on continuous monitoring of her oxygen levels and heart rate. She requires assistance breathing from a ventilator anytime she is sleeping, anytime she's ill. We use a cough assist machine several times a day to help her cough up secretions, and she needs several breathing treatments every day as well. A competent adult must be at her side 24 hours a day to use the suction machine to clear her airways, or she is at risk of choking on her own secretions and dying. It is not exaggerating to say that we save our daughter's life multiple times a day, every day. When she's sick with even a simple respiratory illness, her care needs intensify tremendously. During a 3-month period last summer, we averaged 3 hours of sleep a night so that one of us could be awake at her bedside, taking turns keeping her airway clear. This on top of caring for our farm, our other 2 children, and Rondi working full-time. Adelaide is followed by no less than 7 teams of specialists at Vanderbilt and has on average 2 medical appointments a week. To safely transport her to these appointments or anywhere else requires 2 adults, one to drive the vehicle and one to keep Adelaide safe. As Adelaide continues to do well in her treatment, we've begun looking forward to her educational opportunities. Despite their intense medical needs, most children who survive past the age of 2 with SMA type 1 are able to attend school in a regular classroom with their care provider by their side. However, we've been told by our local school district that unless Adelaide has a private duty nurse assigned to her, she will be declared homebound and denied this opportunity. Children with Adelaide's condition require nursing care, and in the majority of other states, they're eligible for private duty nursing regardless of parental income through that state's Medicaid program. We are not aware of any private or employer-based health insurance product that covers this need, and obviously we cannot afford to pay for this out of pocket. Furthermore, each week Adelaide has a minimum of 4 therapy appointments, which include PT, OT, speech, feeding, and developmental therapy. We're very grateful that these therapies are currently covered under the Tennessee Early Intervention System, but when Adelaide turns 3, TEIS will no longer cover her. Our private health insurance only covers 50 therapy appointments each year. So we would exhaust that coverage in the first 3 months, leaving her without therapies for the remaining 9 months. As you can imagine, our inability to access private duty nursing and other necessary services through TennCare has had a profound impact on our family. Because of the intensity of Adelaide's care needs, the need for 2 adults to transport her to and from medical appointments, and the fact that we have 2 other children to raise, Rondi has had to drastically decrease the number of patients she cares for as a cancer surgeon. I have had to shut down my small-scale agricultural business to be the primary care provider for Adelaide. Our older children have not been able to participate in school activities or sports teams because we have had to be at home caring for their little sister. Over the past year, we have pursued every pathway to TennCare coverage for Adelaide that we could find, and every path that we have pursued has presented us with the same basic options. Either get a divorce and let the parent with no income take custody of Adelaide. Rondi could quit her job, which would leave our entire family dependent on TennCare, or we could move out of state to a state that has a Katie Beckett waiver. The first 2 options are morally and ethically unacceptable to us. We moved to Tennessee because we want to live here. We love this state, and it was our intention to remain here, raising our family and putting down multi-generational roots. Now that we have a daughter with complex medical needs, we find ourselves being forced to choose between the health of our daughter and well-being of our family and our desire to remain in the state of Tennessee. When other children on TennCare receive the coverage that our daughter needs, but we're told it's not available to her, even though there's no way we could have afforded it ourselves, it feels to us like we are being penalized for being hardworking professionals in this state. I'm not a finance expert, but we've been told the cost of this program to the state of Tennessee would be roughly $45 million. That sounds like a lot of money. It is a lot of money. But based on a quick Google search, the 2018 budget for the state of Tennessee was approximately $37 billion. Funding a Katie Beckett waiver using last year's numbers would require approximately 0.12%, or 1/10 of 1% of the total operating budget. To me, that makes it seem like this is less about the ability to fund this program and more about whether the state of Tennessee has the will to fund it. Having a child with a disability or complex medical need can happen to anyone, perhaps even someone that you love. Supporting a Katie Beckett waiver would communicate that these children are important or worth providing the best possible care to, and would tell the hardworking families whose incomes are too high to otherwise qualify for TennCare that they're important members of society in this state, and that caring for their children should not bankrupt them, nor should they be forced to choose between keeping their family together in the state they love or caring for their child with complex medical needs. We again thank you for your time and implore you to support the passage of a Katie Beckett waiver in the state of Tennessee.
Thank you, Mr. Kaufman. Ms. Goddard? No, ma'am. Make sure the little red light's on.
Just kidding, it's not on. Can you hear me now?
Yes, ma'am.
So I'm Tori Goddard. This is my daughter, Zoe. We found out that Zoe had complex, severe heart defects at our 20-week ultrasound. So we went in really excited about what we were going to have, and we came out knowing that we were going to have a heart child. And that changes your world drastically. I had a full-time job, owned my own house, had a really good job. Zoe came out being a little bit more complex than they thought she was going to be. We've had 13 surgeries total. 3 of those 13 have been open heart surgeries. She has had 7 cardiac arrests, 2 of which were in my arms, and 5 strokes resulting from those. We spent 22 months at Monroe Carroll Jr. Children's Hospital in the ICU. So that's 2 months shy of 2 years. That's how long we were hospitalized or institutionalized. When we got out, I could no longer afford her health insurance. She requires, much like they do, 24-hour, around-the-clock nursing care. She also has to be suctioned to keep her airway clear so that she can breathe. We were on the ventilator for a couple of years. We've now been able to come off of it completely, although when we aren't feeling well, we still have to be on oxygen. She is tube fed, so she gets all of her medicines and her feeds through her tube. She does not eat by mouth. But she has been able to start kindergarten in a regular kindergarten classroom at Charlotte Park here in Nashville. So it's a big win for us. We never thought we'd get her out of the hospital, and now she's in a typically functioning kindergarten class. But this was all made possible because of the fact that I quit my job. That's how I got access to care for my child. I had a really good job. I owned my own house, and I could not afford to pay for a private duty nurse or to pay for her medications or to pay for her equipment. She requires a lot. It takes a village. And so my only option, much like them, was to make a drastic change. And I gave up my financial future and my stability to give my child a shot at a life. That's what you're asking these families to do. And we're more than willing to do it. I mean, you do what you have to do for the sake of your child. Quit my job, sold my house for a loss in the best real estate market Nashville has ever seen. And I would do it again in a heartbeat to make sure that she had access to care. We fight for our children's lives, and they have to have access to care. They have to have the 24-hour nursing. And we aren't willing to give up our children because we could. That's what they're asking us to do, is institutionalize them. And I am not willing to give up my child. I fought too hard for her to live. So I quit my job. But you're going to make these families have, we have to have desperate measures in order to make sure that our children live. And what we're asking you is to, as a state, help us, help our kids. So thank you guys so much for taking this.
Thank you. Oh, yes, ma'am.
Hi, I'm Katie Foster.
Would you pull your microphone just a little close?
I'd like to start by thanking the committee with the honor of inviting me to share my story. My family is small. It's just the 3 of us, Mommy, Daddy, and Jonah. Originally, we had planned on having more children, but the last 3 years have taught us that plans don't always come to fruition. Simply put, we cannot afford to have an additional child after considering my son's 20-plus diagnoses, many of which are rare disorders. This was a heartbreaking decision to make. The risk of having another medically complex child was too high for us to risk losing our home or having to move out of state for better health care coverage. My husband and I both grew up in the Memphis area. Our families are here, and the thought of leaving our close-knit families is the reason we have not left the state we love. When I gave birth to my beautiful baby boy, Jonah, we realized that quitting my full-time job was the wisest financial decision for our family. Hiring a qualified in-home nurse would have cost more than I made in a year. My husband makes a very good living of just under $100,000 a year. When you hear that number, it's hard to comprehend how a family like ours could be struggling, but that amount quickly diminishes when you have an unending mountain of medical bills. We had hoped to qualify for TennCare for our child after spend down, but my husband's 401k and our second car put us over the limit. That means we live below the poverty line for our income per household after considering medical bills. The only way we can qualify for TennCare would be for us to sell our second car and to first spend my husband's 401k retirement savings. This would mean we no longer have a way of getting our son to his monthly out-of-town medical appointments, let alone his weekly therapies. The irony of a conservative state asking a family to become completely dependent on the government is striking. And this is coming from a lifelong Republican. We also do not currently, nor have we ever, received any assistance from the state of Tennessee. This is because the current language for TennCare severely limits the definition of disability. As you might have gathered by now, our problem is complex. A large care team of over 20 specialists and counting manage Jonah's 20-plus diagnoses and rare disorders. We travel out of town and out of state for these highly trained and knowledgeable specialists because they are familiar with the rare and complex nature of our son's health conditions. To name a few, Jonah has been diagnosed with laryngomalacia, tracheomalacia, laryngeal cleft, subglottic stenosis, obstructive sleep apnea. Now bear with me as I explain a few of these severe disorders and how they impact his life. Laryngomalacia is the medical term for a floppy esophagus over the larynx. This floppy tissue can collapse and cause him to asphyxiate at any time without notice, but it's more common at night. Most doctors will generally write off this condition as a mild inconvenience that will be outgrown, but in Jonah's case, he is part of a rare 5% of babies with a severe form of this defect that requires constant monitoring and surgical intervention. His diagnosis of tracheomalacia is also rare. TM for short means that Jonah's windpipe constantly collapses while he breathes because of malformed soft cartilage in his airway. Jonah has a constant cough that helps to force air through the windpipe during this continual state of collapse. His chronic cough is the only solution he has to breathe. There is no cure for tracheomalacia, but surgical intervention is recommended to extend the life of TM patients. This two-part surgery entails going through the back and front of the ribcage, permanently removing the thymus gland beneath the breastplate and stitching the collapsed windpipe to the breastplate and the spine to hold it open. This complex and life-saving surgery is only performed at Boston Children's Hospital in Massachusetts. The laryngeal cleft is yet another rare diagnosis and is characterized as a separation between the larynx and the esophagus. The very serious symptom of this condition is continual aspiration of solids and liquids into the lungs. Jonah also aspirates on his saliva and snot. There is no cure for laryngeal clefts, only a surgical option to help with these symptoms. Unfortunately, there are only a handful of knowledgeable and trained specialists with the expertise to correctly perform the surgery. None of these specialists are in Tennessee. We are still constantly learning more about Jonah's rare diagnoses and have had to stop many diagnostic tests because our private insurance has refused to accept the claims. We are faced with the horrendous decision of choosing which diagnosis is the most severe and in the most need of intervention. We are also already seeing the consequences of putting off needed therapy. The lack of desired weekly feeding therapy has contributed to serious oral aversions and delays. It has been recommended that we leave Jonah at a feeding therapy clinic alone in West Virginia until they can correct some of these delays. This is absolutely not an option we are willing to make, so we trudge on every week trying to help our son learn to eat. There are no references or guidelines as to whether my son's health will improve or decline as he grows. At the moment, he is somewhat stable, needing all liquids thickened, daily nebulizer treatments, and multiple weekly therapies to help him learn to correctly swallow, pedal a tricycle, and use a fork. But this will likely change. We traveled to Nashville for most of Jonah's specialist appointments and will soon be under the additional care of a highly specialized upper airway team in Cincinnati, Ohio. Jonah undergoes monitored procedures under anesthesia by these complex medical teams to evaluate whether immediate surgical interventions are needed. On a daily basis, our financial need isn't too excessive, but the multiple surgeries and procedures every year, specialist appointments, and multiple therapies a week, and travel all add up to an astonishing amount of money within the few months of the new year. All this to say, I have come to realize that the state of Tennessee seems to only understand medical needs if they are easily comprehended. Down syndrome and autism, which are somewhat common and have plenty of medical backing and research, are a few examples. When it comes to a rare diagnosis, the state casts these children and their families aside and deems them unworthy of help. The reality with a rare diagnosis is that families like mine battle with doctors daily to be taken seriously and heard. If we are fortunate enough to find a knowledgeable doctor, we often don't have the finances to pursue treatment. The Katie Beckett TEFRA program would mean families like mine could get assistance meeting our high max out-of-pocket deductibles. We could get necessary weekly therapies covered, along with equipment, thickener, and medications. That financial help would greatly impact our burden of budgeting for hotel rooms when patient housing is unavailable, food while traveling, and endless tanks of gas. Our family is not alone in this unique situation of being in a medical no man's land. I have the privilege of knowing 18 other families in the Memphis area alone with children who suffer from complex airway disorders similar to Jonah. We are all trying our best to keep our heads above water, but we need your help. Each of you has the honor and privilege of being our chosen representatives. Our hope is that you will understand the great need for the Katie Beckett TEFRA program to pass in our state, to keep families together, healthy, and thriving. Thank you.
Thank you. Members, are there questions for our witnesses? Seeing none, thank you. Thank you very much for being here with us today and sharing your story. Thank you very much. Okay, members, we'll come out of recess. We're back in session. We're back on the amendment 6244. Are there questions for the sponsor oh, I'm sorry, yes, 6388. We're on amendment 6388. Are there questions for the sponsor on the amendment? Seeing none, those in favor of adopting the amendment say aye. Aye. Opposed, like sign. Amendments on the bill. We're back on Senate Bill 476 as amended. Are there questions for the sponsor? Senator Lundberg, you're recognized.
Thank you, Mr. Chairman. Great legislation, so I'm proud to have my name behind yours. One of the things that's going to come up is Chairman Watson is going to see this again if we can pass this today, which I hope we do, and there is a cost to it, and I'm just wondering how the departments are dealing with you and helping to make this cost effective, because I think as a state it is, I think Adelaide's father made the point that I think was spot on, which is, as a policy of the state, I don't want them to have to get a divorce, quit their jobs, or move. So,
Well, first of all, let me just say, if I may, I want to thank the families who came here today and to be able to stand here and watch Zoe and Adelaide while their parents gave testimony. It really hammers home the fact that this is a situation where we're trying to provide a true safety net. You know, I don't know what you think of when you hear those words about a safety net, but it gets used a lot. But sometimes those words get used when it's people who probably could take care of themselves, but this is not the case here. There's no one to care for these children except for their parents or the state. They cannot care for themselves. They can't provide for themselves. And I'm reminded of a very profound work by Arthur Brooks of the American Enterprise Institute. He wrote a book called The Conservative Heart. And it basically underscored the idea that there are certain things that society ought to do to help those who cannot do for themselves, who truly can't do for themselves. And in this case, I don't know what the revised fiscal note is, but it's about $40 million. And so the question is going to become, do we have things? We get requests all the time for money to be spent. And sometimes we say yes, sometimes we say no. Sometimes those fall under the category of wants, sometimes they fall under the category of needs. I suspect, although I've not specifically asked this of the department, I suspect that if we just simply look at the jobs that they have budgeted for every year that go unfilled, that might possibly be enough money to pay for this itself. But I think, to answer your question, we will have to establish that this is a need, not a want, and we're going to have determination to find the money to fund it. And so that will be a challenge, and that'll be something, of course, that we take up in the Finance Committee. But I think it's going to be real important for everybody to realize this is going to take a team effort to get this funded.
Further questions? Seeing none, question's been called on the bill. With no objection, call for the vote, please. Take the vote.
Senator Ackberry. Aye. Votes aye. Senator Gresham. Aye. Votes aye. Senator Johnson. Aye. Votes aye. Senator Lundberg. Aye. Votes aye. Senator Nicely. Aye. Votes aye. Senator Sutherland. Aye. Votes aye. Senator Swan. Aye. Votes aye. Senator Watson. Aye. Votes aye. Chairman Bailey.
Aye.
Chairman, you have 9 members voting aye.
Senate Bill 476 as amended will move to the Committee on Finance.
Thank you, Chairman. Thank you, Committee.
And again, thank you for our guests for being here today and sharing your story. Thank you very much. Okay, Senator Roberts, we're going to continue with your calendar today.